Hello everyone, welcome to Visan's Anatomy. Today we are going to learn about the muscle attachments and relations in mandible. Already we have learnt about mandible and its features in part 1. I'll give the link in the description box below. Those who want to learn about it, you can check it out. The external surface of body of mandible is seen in face. So the muscles attached to this surface will be the facial expression muscles, and especially these muscles get originated from this surface. From the incisive fossa, mentalis muscle get originated. In the external oblique line, 3 muscles get originated, one below the other. In the upper part of external oblique line, the lower fibers of buccinator will be originated near the mandibular third molar. Just below this, we can see the origin of depressor anguli oris, and below this, we can able to see the origin of depressor labii inferioris. Through the mental foramen, mental nerves and vessels passes through it. On the internal surface of body of mandible, from superior genial tubercle, genioglossus muscle originates. This is the main muscle of tongue. From the inferior genial tubercle, geniohyoid muscle originates. From the mylohyoid line, mylohyoid muscle originates. Geniohyoid and mylohyoid comes under the group suprahyoid muscles. In the submandibular fossa, submandibular gland is lodged along with the submandibular lymph nodes and facial artery. In the sublingual fossa, sublingual gland is lodged. In the alveolar border, we can see the teeth or the sockets for the tooth. In the base of the mandible or the lower border, the investing layer of deep cervical fascia is attached throughout. In the digastric fossa, anterior belly of digastric is attached. In the ramus of the mandible, the muscles attached is mainly the muscles which moves the mandible in the temporomandibular joint. It is none other than the muscles of mastication. Especially these muscles of mastication, all the muscles are inserted in the ramus of the mandible so that they can move the mandible during the movement of temporomandibular joint. So in the ramus, it has lateral surface and medial surface and 2 processes. In these 4 areas, these 4 muscles get inserted. We'll see one by one. On the lateral surface, the masseter muscle gets inserted. On the medial surface, just below the mylohyoid groove, the medial pterygoid muscle gets inserted. On the coronoid process, its apex as well as on the medial surface and lateral surface, temporalis muscle gets inserted, and also along the anterior border of ramus of mandible. On the pterygoid fovea, which is present on the anterior aspect of condylar process, lateral pterygoid muscle gets inserted. Apart from the muscles, ligaments also attach to the mandible. We know mandible is the only movable bone and forms temporomandibular joint. Just above the head of the mandible, the articular disc of temporomandibular joint is related over there. At the neck of the mandible, the fibrous capsule of temporomandibular joint is attached. At the lingula, sphenomandibular ligament is attached. At the anatomical angle of mandible, stylomandibular ligament is attached. At the posterior end of mylohyoid line, pterygomandibular raphe is attached. The structures passing through the mandible. On the medial surface of the mandible, we can see mainly the mandibular foramen, through which the inferior alveolar nerve and vessels passes through. From this foramen, they passes deep inside the mandibular canal, where they give the dental plexus and supplies the lower jaw teeth except incisors. This inferior alveolar nerve and vessels exits through the mental foramen as mental nerve and mental vessels, and they supply the incisors through the incisival branches. Before entering into the mandibular foramen, they give out mylohyoid nerve and vessels, which passes through the mylohyoid groove after piercing the sphenomandibular ligament, and then it supplies the mylohyoid muscle and anterior belly of digastric. The lingual nerve, which passes just above the mylohyoid line, very close to the medial aspect of the mandibular third molar, which passes antero-inferiorly. Apart from this attachments and the structures passing through, we have some structures that are closely related to the mandible. So we know the mandible has a head and a neck portion. So at the level of neck, many structures are related. So here we can see the neck of the mandible. The first structure, the external carotid artery. At the level of neck of the mandible, it terminates as maxillary artery and superficial temporal artery. So we can say external carotid artery terminates here, maxillary artery originates at the level of neck, and superficial temporal artery originates at the neck of the mandible. At the same time, from the pterygoid plexus, the maxillary vein joins and forms here at the neck of the mandible, and superficial temporal vein that terminates at the neck of the mandible. So both the maxillary vein and superficial temporal vein, they joins and forms retromandibular vein at the level of neck of the mandible. And next structure is the facial nerve. After exiting from the stylomastoid foramen, the facial nerve just crosses the styloid process and enters the parotid gland. At the level of neck of the mandible, the facial nerve terminates into its 5 terminal branches. So we can able to see a artery, a vein and a nerve relations at the neck of the mandible. And at the masseteric notch, we can able to see the masseteric nerve as well as the masseteric artery and masseteric vein, which crosses from the medial aspect to the lateral side to supply the masseter muscle. And in the sublingual fossa, we can able to see the sublingual gland, and in the submandibular fossa, we can see the submandibular gland. And just behind the incisor teeth, the tip of the tongue is related. And over the lateral surface, already we know the lateral surface is covered by the masseter, and over the masseter, most of the lateral surface of ramus of the mandible is covered by the parotid gland, along with the parotid duct, which is related in the anterior border of the ramus of the mandible. Along with the parotid gland, the parotid ducts are also related on the lateral aspect of mandible. So we can see the summary of today's portion now. So on the external surface of body of mandible, we can see the mentalis muscle. In the external oblique line, we can see buccinator, depressor anguli oris and depressor labii inferioris muscle originating. In the mental foramen, the mental nerves and vessels passes through it. In the internal surface, from the superior genial tubercle, genioglossus muscle originates, inferior genial tubercle, geniohyoid originates, mylohyoid line, mylohyoid muscle originates. In submandibular fossa, submandibular gland, along with the submandibular lymph nodes and facial artery are lodged. In sublingual fossa, sublingual gland is lodged. In the superior border, the teeth is seen or the sockets for the tooth are seen. In the lower border, investing layer of deep cervical fascia is attached, and in digastric fossa, the anterior belly of digastric muscle is attached. In the ramus, lateral surface masseter is attached, and on the medial surface below the mylohyoid groove, medial pterygoid muscle is attached. On coronoid process and the anterior border of ramus of mandible, temporalis muscle is attached. In pterygoid fovea, lateral pterygoid muscle is inserted. The ligament just above the head, we can able to see the articular disc. At the level of neck of the mandible, fibrous capsule is attached. Sphenomandibular ligament is attached to lingula. Stylomandibular ligament is attached to anatomical angle of mandible. And pterygomandibular raphe is attached to the posterior most part of mylohyoid line. And structures passing through the mandibular foramen, inferior alveolar nerves and vessels. In mandibular canal also, inferior alveolar nerves and vessels, which gives the dental plexus to the lower jaw tooth except the incisors. And this inferior alveolar nerves and vessels, they exit at the mental foramen and continuous as mental nerve and vessels, which supply the incisor teeth through the incisival branch. And in the mylohyoid groove, we can able to see the mylohyoid nerves and vessels which pierces the sphenomandibular ligament. The lingual nerve, which is related very close to the medial aspect of the mandibular third molar and which passes anto-inferiorly above the mylohyoid line. And at the level of neck of the mandible, we can able to see the termination of external carotid artery, origin of maxillary artery and origin of superficial temporal artery. And we can see the termination of maxillary vein, termination of superficial temporal vein and the origin of retromandibular vein. And at the level of neck of the mandible, the termination of facial nerve happens, that which divides into the 5 terminal branches. And in the masseteric notch, we can see the masseteric nerve, masseteric artery and masseteric vein. Submandibular fossa, submandibular gland and sublingual fossa, we can able to see the sublingual gland, and behind the incisor teeth, we can see the tip of the tongue. Over the lateral surface, we can see the parotid gland as well as the parotid duct with the parotid lymph nodes. If you find this video useful, share it with your friends and subscribe the channel to get the updates of upcoming videos. Personal online classes and coaching are undertaken. The students who are interested can contact in the email ID given. I'll meet you in the next video. Bye-bye.